We are back here on Healthy Living. I would like to introduce you to Dr. Edward Blocker. Nice to meet you.
Good.
We're very excited that you're here at Novant and curious also. Tell us a little bit about your background and where you're from.
I'm from South Carolina. I've been here, raised in this state all my life. Grew up in Charleston. All my family's from Charleston, both sides of my family.
Oh, are
going
they
back
really?
Generations. So I feel like the Lowcountry is really home to me.
You know what's interesting? I did hear a little scoop on you that you grew up and both sides of your families were in construction or contractors.
So my one grandfather on my father's side was a carpenter, built houses, and my grandfather on my mother's side was an orthopedic surgeon.
I just think it's so interesting, and here you are. Did they think they would get an orthopedic surgeon?
Well, I decided at an early age, working with, particularly my carpenter grandfather, I enjoyed using my hands.
Yes.
And as a 7-year-old, because of my other grandfather, I knew what orthopedics was. So at an early, I would say 7 years old, I decided that's what I wanted to do.
Did you really? Were you that kid that kind of set a plan and worked the plan?
Yep.
Oh, see, I absolutely love that. I think that's amazing. Talk to me about working for Novant. What is it about Novant that you were excited about participating?
So it sounds like, it's in their mission statement. Novant, I think, focuses on the individual patient, and one patient at a time to benefit the entire community.
So quality of care and really working for the good
Quality
of the
of
whole.
care with emphasis on patient care.
So this is an exciting thing for you.
Absolutely, yes.
So if you will, talk to us a bit about your specialties, what you really enjoy doing in the field of orthopedic surgery.
The two things I enjoy the most is robotic knee replacements and robotic hip replacement surgery.
And what we're going to do in a few minutes is we're going to bring you and Dr. Jones back in, and we're really going to talk about the magic that's behind us right now. Talk to me before, though, a little bit about hips and about knees and what it is about those particular areas of the body that are fun to work on. Is that an odd question?
Sure. No, it's absolutely.
Fun?
I would say that those two surgeries are orthopedics / carpentry at their best. You have a knee or a hip that's worn out and to the point that it's causing too much pain and impairment of quality of life and mobility, and we can, in the case of a knee, resurface it, and in the case of a hip, basically resurface and replace the joint, so that by restoring the joint's ability to function mechanically, we can therefore improve the patient's quality of life.
Well, at 71 years old, I become more and more interested in those kinds of surgeries. And I think for many people around here anyway, we're so active. It's not like our grandparents' who at 71 weren't thinking about pickleball or running or hiking with our kids. And so at what point in time does someone need to come to an orthopedic surgeon about their knees or their hips? What is your recommendation?
My philosophy is, and I tell this to patients every day, listen to your knees or your hips or whatever's ailing you. Your knee or your hip will tell you if it's time to do something. So, there's certainly nothing wrong with keeping going if it seems like a level of discomfort that's not slowing you down. It's usually, a lot of times, the spouse comes in with the patient, and they're mainly there because the spouse has pointed out that they were slowing down the patient.
Maybe I'm walking a little bit funny or something like that. That makes sense to me.
There's usually not a scenario where there's a point of no return, though. I don't think I've ever said you should have come in 5 years before. But I think the biggest thing is for people to realize there are things that can be done, not just surgically, but even non-surgical options. Simple things, from simple to complex.
Sure.
When your mobility is impaired, your quality of life is impaired. And we can help that.
I think it's so important that we're talking about this right now, and I think what you just did is sort of debunked myths. So hips and knees are something that can be restored and can really improve your quality of life.
Absolutely, and it's best if it's reached the point where it is impairing the quality of life. That's when to consider it. On the flip side of that, I would not recommend a hip or a knee replacement. It doesn't give you, it doesn't return you 20 years of your life back, but if your hip or knee has gotten to the point where it's slowing you down, we can get you back on track.
I think that's managing expectations. I think that makes a lot of sense. We're going to take a quick break here on Healthy Living. We'll be right back, and we're going to talk about something called robotic surgery and the Mako. So stay with us. We'll be right back on Healthy Living.